basics of adult CPR class here. So we're going to learn about what to do when a victim is found not breathing or without a pulse, sorry, I should say and. Knowing the components of high quality CPR and how to perform it, and also knowing how to use an AED and applying it to the victim. So, just little facts here. Research shows that 70% of all pre-hospital cardiac arrests happen at home, and only a small amount of these people survive unless a rapid sequence of events occur. This rapid sequence of events is called the chain of survival. This also improves patients' chances of surviving drastically. Go ahead. Oh, there we go. All right, chain of survival. So first one would be the recognition and activation of emergency response system. This is recognizing that the victim is not breathing, does not have a pulse, and then they're quickly activating EMS by calling 911. And then the immediate high quality CPR, along with rapid defibrillation if there's an AED available. And then as soon as EMS crews arrive, they'll start giving basic and advanced emergency services like advanced airways, IVs, give them medications. And then after that, transport to the hospital, and they'll get a lot of advanced life support and post-arrest care if they make it that far. So components of CPR with an AED. So you're going to first recognize that the patient is in cardiac arrest, no pulse, not breathing. You're going to rapidly activate EMS, and then you're going to retrieve an AED if possible, have someone go get it for you. And then you're going to hop right into high quality CPR. This includes going at a compression rate at 100 to 120 compressions per minute. You're going to do a compression and ventilation ratio of 32 if available. If you have a mask, be able to give ventilations. If not, then you're just going to give continuous compressions. You're going to allow complete chest recoil, and then you're going to have no longer 10 seconds of interruption between compressions and ventilations. And then with each ventilation, you're going to make sure you're giving adequate breaths by watching chest rise and fall. And then once you get an AED, if possible, you're going to turn it on, you're going to follow the prompts of what it says, and you're going to attach pads to the patient. You're going to stop CPR and clear the patient for the rhythm analysis. You're going to ensure the patient is clear of any respiratory fibrillation when it recognizes. And then you're going to immediately resume CPR after shock is administered. So, right now, we're going to go ahead and just do a little demonstration. We'll do a 2-minute full cycle of CPR here real quick on this mannequin. A full cycle of CPR we're going to demonstrate here real quick. So, find the victim lying on the floor. I'm going to go up to him, see if he has any responsiveness. Sir, can you hear me? Nothing. I'm going to check for pulse and breathing at the same time. Got nothing, so I'm going to have someone activate EMS, call 911, and go grab an AED if possible. Now I'm going to hop right into CPR, doing a compression rate of 30 to 2, along with going at a compression rate of 100 to 120 minutes. Alright, between each breath and ventilation or compressions, make sure there's no interruption between 10 seconds. Give 2 breaths. Watch for chest rise and fall, and then hop right back on. You make sure to. I already flew through all those. We're good. Just go again to another 32 here. Checking chest rise and fall with each breath. This will be the last cycle right here. And then you're just gonna continue that until EMS crews arrive or an AED comes, and just till basic order advanced life support arrives.